Hey future nurses, welcome back to ManpreetRN Talks. So in this video, we are going to discuss about the next cardiac drugs for you need to know for the NCLEX exam is the beta blockers. So what are beta blockers? So drug classes is antihypertensive, anti-anginal, and antiarrhythmic. So common ending like the olol. So you can remember the drugs they are which are ending in the olol like they are beta blockers. For example, metoprolol, Atenolol, Propranolol, Carvedilol, and Labetalol. So often used in hypertensive emergencies like Labetalol. Mode of action. So basically, it blocks the beta adenosine receptors primarily in the heart. So that lead to decrease in the heart rate and decrease contractility. So also leading decreased blood pressure and decrease myocardial oxygen demand and also slow AV conduction. So it acts as a decreased heart rate. It acts as a negative chronotrope and the decreased contractility of the heart is like act as a negative inotropes. NCLEX tip is here. Beta blockers, you can remember, blocks the beat. So they slow the heart rate, reduce blood pressure, and protect the heart. So common indication why we give them for in like in the hypertensive, heart failure, post MI, angina, chest pain, atrial fibrillation to control the heart rate, and anxiety off label. And next is contraindication or use with cautions. Like patient when patient is having bradycardia, so we will not give beta blocker, heart block, wave to second and third degree beta heart block and patient asthmatic and COPD patient. So because it act as a bronchospasm, they can lead to bronchospasm. So we cannot give beta blockers in the asthmatic or COPD patients like propranolol. Or in diabetic patient because it masks the hypoglycemia symptoms. And in severe peripheral arterial disease, we cannot give beta blockers. NCLEX nursing considerations. So before giving, always check apical pulse for 1 full minute. So hold if heart rate is less than 60. Check blood pressure. Hold if systolic blood pressure is less than 100 mm of Hg. So always monitor for bradycardia, hypotension, signs of heart failure worsening like weight gain, edema, sudden onset of breath, and patient teaching. So do not stop suddenly. So it can cause rebound hypertension or MI. So rise slowly because it can lead to orthostatic hypotension and report weight gain, shortness of breath, and fatigue. For diabetes patient, always monitor blood glucose more closely because it masks the hypoglycemia symptoms. So practice question. A patient with asthma is prescribed propranolol. So what should the nurse do first? A. Administer the drug as ordered. B. Monitor pulse rate closely. C. Hold the medication and notify the healthcare provider. D. Teach the patient to monitor for bradycardia. So you can remember in the asthmatic patient, we cannot give uh, beta blockers. So always hold the medication and notify the healthcare provider because propanol can cause bronchospasm, bronchoconstriction. So it should be avoided in asthmatic patients. Quick beta blocker mnemonics so you can remember for the NCLEX exam like blocker. So B bradycardia, L low BP, O onset of fatigue or dizziness, C caution with diabetes like it masks the hypoglycemia, K keep an eye on heart rhythm, E erectile dysfunction, so R respiratory concern in the asthmatic patient, so it causes bronchospasm. And that's wrap up everything you need to know about beta blocker for the NCLEX. So remember for the classical science. And if you find this helpful, give it a thumbs up and share with your nursing friends and subscribe this channel for more NCLEX prep videos. And stay focused, stay confident, and always keep learning. Thanks for watching it.